Here's our closet where we keep all of our stuff, all of our good stuff. It's always good to have extra supplies on hand when you can get them, and you'll probably find that you easily stockpile some things at first. After a while, you kind of get used to what you need to order and how long things last. And as I said before, the denture cleanser, it's important for us, at least, when we're cleaning stuff, especially stuff that's had milk in it. And lots of posies, and back here is where I keep the little tiny odds and ends, and I try to label stuff. I saved some sterile gloves and masks, or sterile gloves, and just for if we had to do some kind of a procedure where we needed a more sterile kind of a thing. But most of the time the gloves out of the catheter packages are just fine. You'll probably get one of these Red Robins. It's important to know where that is and have one in your go bag, and they'll tell you all about that whenever you get the GJ, because it's something that's related to the care of your G-tube if it comes out. What you do to keep the hole stable and open while you're waiting to go see the doctor or have it put back in. This shelf is a lot to do with the ventilation, and of course these are all the monitoring cords that we get when you go to the doctor's office. They'll use a monitoring cord and then they're just going to throw it away. So ask them, are you going to throw that away, and if not, can I have it? So these are all of the once used monitoring cords that we've gotten from the doctor's office. They're perfectly good and they last a long time. This is the trach care kits that they brought out, and I told you I just really didn't even know what it was for. It was kind of weird. I'm going to show you what's inside. So when I said trach care, I was thinking like, you know, his daily care where you change the gauze and clean it with the half peroxide and half water. But I guess what they were considering trach care is cleaning a trach, which we don't do. We just take them out and throw them away and put a new one in. So anyway, there's like this big sterile drape, and then there's gloves. It's all sterile, so of course mine isn't now that I've touched all over it. These two tiny little Q-tips. And this thing is kind of cool. Sometimes you need like a little brush to clean something, so you got a little brush and some pipe cleaners and some gauze. So, you know, there are some good uses. We've used this before for different things we needed to clean or fix up, and it's got these basins, so, you know, I guess it has some redeeming quality. I just was wondering, I didn't get when they brought this out and said this is what you're using for trach care. That didn't make sense to me at all. And when I asked him about it, he said, well, these are the kits that we can bill for, but Q-tips we can't bill for. I thought that was kind of crazy. Anyway, here's our extra suction machine. Keep that right here in case our other one goes bad. And of course, when we go on a trip or anything, we have to take that one as our backup, as well as our travel one. Here's all of my colorful folders. Keep all my receipts from different providers, and then all of this is nursing notes, because the nurses actually take nursing charting. Here's more nursing charting, and they give you a copy of every single day that they're there. And I decided to keep all of them. I don't know why, but I just thought I might need them sometime. And it is kind of nice. Like sometimes you can look back on that nursing charting and figure out something that you have a question about. So anyway, it's our closet. We keep Grayson's laundry down here because the nurses, you can ask them to do the patient's laundry. And so anytime that we got a basket full, I would just say, hey, can you throw in a load tonight while you're here? And fold them up. And that was a pretty nice little perk. And while I'm thinking about, you know, I was talking about the traveling with the extra suction machine. While I was thinking about it, we're actually getting ready to go on a trip this weekend. It's only the second trip we've really gone on. And you know, this is just a reminder that your life is different than other people's now, because my suitcase is a backpack and Bob's is a shoulder bag, and Grayson's suitcase, it's not really full yet with all the stuff we're going to take, but this is all the stuff we're packing to take with us on our trip. And it's a big old suitcase full. And it does take up pretty much half of our vehicle to carry his medical gear. But, you know, you'll figure it out, just like we did. Anyway, things are going great for you, and we're thinking about you all the time.